Hey, Dr. Coleman, is there a reason to get off of Suboxone or Methadone?
Well, that's a great question. And, methadone and Suboxone are two of the forms of medication-assisted treatment, and they're very effective. They really do prevent or help people to stay in recovery, to not use street opioids. That keeps them safe from overdose and from other complications. And so, why would you get off of those things if they're working so well? Well, for a lot of people, they shouldn't get off of them. They should stay on them because they're working so well. If I had a loved one that was in certain categories of, risks and stuff like that, I would absolutely be recommending they get on one of those medicines and staying on them. The drugs do have some side effects, in terms of some physical things and maybe even some psychological things, and a lot of people just don't want to be on drugs of any kind, and so they want to be off of them. That's similar to blood pressure drugs or diabetes drugs or antidepressants or other drugs. So, as physicians, we want to use as few drugs as possible, but we're always analyzing and evaluating the risk and benefit. And the benefit of being on MAT is very high in terms of what I've talked about, preventing overdoses and keeping people stable and not getting the dopamine high from street drugs, so that people can feel confident and feel stable and then get on with their lives and really start improving all the other aspects. At some point, people may be able to get off these drugs, and that's again an individualized thing, that the decision that needs to be made between the patient and the doctor and their provider, and maybe input from their family members and their sponsor and 12-step programs and other people can all have input as to when people don't need those drugs anymore. But it's always risky getting off of them, and so you don't want to go off of a drug, whether it's an antidepressant or it's an MAT, unless you're really sure that people are going to be doing well and they really have changed from their old lifestyle of using street drugs, and they're at very, very, very low risk of relapse, and they've got a good support system to keep track of things so that they don't fall back into old addictive behaviors.